My name's Gemma Faulkner. I'm a consultant general and colorectal surgeon at the Royal Bolton Hospital. I've worked here for 5 years. Well, I think the Enhanced Recovery After Surgery Plus project is a fantastic initiative. It's actually not a new project, as Enhanced Recovery After Surgery programs have been going for quite a number of years. But the new emphasis in the ERAS Plus project is trying to reduce the incidence of respiratory complications in patients undergoing major surgery. So that's things like chest infections. And that's because we know that if patients suffer those type of complications, it does impact on their recovery time, and it actually impacts in their overall survival. So I'm really enthusiastic about the project, and I've been involved with it since the start here at Bolton, and I think it's already making quite a big difference to patients. I am involved in the local ERAS Plus committee. I'm also involved in the wider Greater Manchester initiative, but specifically because I'm a colorectal surgeon, I carry out major surgery on patients with bowel cancer, for example, and my role really is to initially educate the patient about what to expect about their operation and how they'll participate in the Enhanced Recovery Programme. So I see myself as empowering the patient to get themselves in the best physical and mental state for major surgery. I think that this is, even if we only have a very short period of time, which is sometimes the case with bowel cancer surgery, as we do have to operate on patients relatively quickly, even if we only have 2, 3, 4 weeks before their operation, we can actually get them a bit fitter, and we can prepare them better for the stress of surgery, and we can reduce the impact or the stress that the operation has on them, and that helps them to recover quickly from their surgery, to get home quicker. And also, in the case of specifically the operations that I perform, these patients may sometimes require further treatment in the form of chemotherapy, and it's important that they have that quite quickly after they've recovered from surgery. And by going through the ERAS Plus programme, we hope that that means that they will recover adequately so that they can then have that treatment, which may affect their survival in the long term. I think that we need a bit of a culture change generally in terms of surgery, particularly the surgery that I offer. We need to move away from the attitude of surgeons, doctors, nurses, healthcare professionals doing things to patients, and we need to see it more as a kind of a team effort in getting patients through major operations, which might be the biggest thing they've ever faced or will ever face in their life. I describe it to patients as going through major surgery is like running a marathon they have to train for. So we want to empower the patients to feel prepared, and their relatives to feel prepared for major surgery. And I think that we're already seeing that difference in that patients are appreciating that by exercising prior to their operation, even if it's only for a couple of weeks, increasing their activity levels is helpful. Brushing their teeth, carrying out their incentive spirometry. We're already seeing that patients are feeling or reporting that they are feeling better prepared for surgery, and that they know more what to expect after the operation. So in that respect, it seems that patients are starting to experience a bit of a culture change, and they do seem to be benefiting from the programme at this point.